Good morning. I'm Dr. B. It's so nice to meet you. I've been told that you're having some concerns about your heart. Yeah. Would it be okay if we started with an exam? I want to rule out anything more serious. Okay. Do you mind telling me your name? Okay. And your date of birth? Okay. Your temperature is normal. I'm going to listen to your heart now. We're going to get right into it. Right near your neck, okay? Okay. Your heartbeat's very strong, okay? It's very strong. Can you tell me more about your concerns? Yeah. And when did you notice that? Okay. Yeah, did you tell anyone? Yeah. Do you live with anyone? Okay. So, I want to do a few more assessments and get your vitals. And then I will see. We'll see after that, okay? Okay. Slip this on your arm, okay? And just make sure your legs are uncrossed. Okay. Okay, your blood pressure is normal. 119/85. I actually just want to get your pulse for a second. Just hand me your wrist here. Okay. You're at about 80 beats per minute. Okay. We're gonna do a little assessment around your face and neck, okay? Again, I'm ruling out anything more serious. But you're doing great, and so far your heart is very strong, okay? I ask that you open your mouth for me. Okay. Say, ah. Okay, that looks good. I'm gonna take a look up your nose, so tilt your head just up a little bit, okay? Very good. Taking a look into this ear for me. Just sit still. Okay, and over here. Perfect. Okay, I have this little tiny hammer. I'm going to tap on your face. I want you to tell me if it hurts. Okay, if you feel any pain, like a bruise or any discomfort. Okay. So far, so good. Okay. Okay. I'm going to put some pressure on your face, and the first one I'm going to do, I'm going to push this way. I want you to push against me, okay? So try to turn your head that way. Ready? Push, push, push. Good. Other side now. Push, push, push. Good job. I'm going to try to close your eyes, and I need you to open them, okay? Ready? Try to close your eyes. Oh, good job, good job. I'm going to try to open your eyes, and I need you to keep them closed, okay? Good, very good. This time it's going to be your eyebrows. I'm going to push down on them. You lift them up for me if you can. Pushing, push, push, push. Good job, good job. Okay, now I'm going to push backwards on your face. I'm going to push your neck back. I want you to be strong. Push forward for me, okay? Push, push, push. Good job. Very good, very good. Gotta take a sip. Okay. You're doing great so far. Yeah. Are you enjoying this test? Okay. Yeah, some people find it fun. Okay, I'm gonna feel your neck for lumps and bumps. Okay. Okay, I'm feeling the back of your neck now, around your spine and shoulders. Give you a little massage. Okay, new test. I'm gonna push down on your shoulders. You lift up for me, okay? Pushing down. Push, push, push. Good job. Okay, can you look to the side for me? Turn your head like that. Perfect. And then this side. Okay, very good. Can you look up for me? And down. Perfect. Now, keeping your neck still, I want you to just move your eyes so you can follow my finger if that helps. So, here's my finger. Follow. Very good. Following. Very good. Keep following my finger. Can you tell me what shape I'm tracing? Good. What's this one? Good. Tell me about this one. Very good. I'm going to shine a light in your eye. It's going to be a little bright, okay? I want you to stare right at my nose. Bright light coming. Keep looking right here. Okay. I got this tea at the coffee shop downstairs. It's really good. Yeah. It's called Vanilla Almond, and I'm normally not a person that really likes almond flavored things, but it's good. Yeah, you should try some if you want on the way out. It's really good. Okay, so I want to try something with you. I want you to tell me what color you see in this corner, okay? I'm going to change the color with my remote. Okay, tell me about this color. Very good. Let's do it again. What do you see? Okay, that's perfect. You're a pro. We're going to keep going. Good. Good job. Okay, good job. Yeah, that's good. Good job. Okay, I've got one more test I'd like to do with you. I just want to check your lungs because there's a chance that your heart might be working a little too hard if you're not getting enough oxygen, if you're having asthmatic symptoms. So I want to rule that out. Have you ever seen one of these before? This is called a peak flow meter. It's going to tell us your lung performance roughly. They're not perfect, but they give us a pretty good idea. Okay. So, what you're going to do is you're going to take a big breath in like this. And as you exhale really hard, as fast as you can. Exhale all the air out until you have no more air in your lungs. Yeah, you're going to exhale right into here, and it's going to read your exhale. It's going to read how hard you can exhale. Okay, deep breath in. Okay, put your mouth right on the mouthpiece and exhale, exhale, exhale. Almost there. Okay, good job, good job, good job. This is a little lower than I'd like to see it, so I'd like to refer you to a respiratory specialist. I can send you home with a rescue inhaler today. Those are very safe, and you can use that as needed. Yeah, if you're noticing any symptoms. It sounds like you don't notice symptoms too often, but it's there if you need it, as needed again. Okay? Yeah. I want to check on your lungs after all these tests and see where you're at. Excuse me, check on your heart and see where you're at, okay? Up on your temple now. Your heart is still very strong and a little slower. Are you noticing that too? Yeah. I want to do an anxiety screening today. Would that be okay? Okay. Okay, I'm going to ask you some questions about how you've been feeling over the last 2 weeks, okay? And you're going to respond with not at all, several days, more than half the days, or nearly every day, the idea is I'm going to ask you if you're, for example, feeling nervous, anxious, or on edge, and let me know how much in the last 2 weeks, okay? And that's the first question, is if you've been feeling nervous, anxious, or on edge. Okay. Over the last 2 weeks, have you experienced not being able to stop or control worrying? Okay. Worrying too much about different things? Okay. Trouble relaxing? Being so restless that it's hard to sit still? Okay. Becoming easily annoyed or irritable? And feeling afraid as if something awful might happen? Okay. My last question for you is, how difficult have these problems made it for you to work, take care of things at home, or get along with other people? It could be not difficult at all, somewhat difficult, extremely difficult. Yeah. Okay. Okay. So, based on the screening, you're probably at moderate to severe on the spectrum, and this explains a lot. I want to tell you first that you are very normal. Half of my patients have moderate to severe anxiety. Half of the people that come in with a heart condition, really more than half. So you're nothing bad is happening. This is a very normal experience, okay? And there's absolutely nothing wrong with you or wrong with this. This is something we can work with, okay? Yeah, you're really gonna be okay, I promise. But anxiety stinks. It is uncomfortable, and long-term anxiety isn't so good for us, right? So, I have a unique approach, and this is really important to me. And if it's okay with you, I'd like to spend a little time talking about anxiety, maybe practicing some tools together, and just making sure you have everything you need. We can definitely talk about medication, but before we do that, I want to talk about the tools first and see how it goes, okay? Basically, we're just gonna hang out for a little bit, and I just want to know more about you, more about what makes your anxiety worse, what your triggers are. Yeah, of course. Now, would it be okay if I lit a candle for us? I think it helps, yeah, set the mood a little bit, yeah. You want to smell it? Yeah, that's kind of nice. Okay. We can just watch this burn for a second. What do you notice about this? It is getting close to my fingers. Yeah, I noticed that too. What else do you notice? Yeah. Do you smell? Yeah. So, I have a question for you. After watching that burn, how are you feeling? How's your anxiety? Yeah, it's pretty low when you're around others. Yeah. When you're not the center of attention. Yeah, so maybe would you say it's accurate that you might have some social anxiety? Yeah, that is normal, yes, I promise. Truth be told, I have that too. I'm really good in one-on-one, but the larger the group, the harder it is for me. So, you're not alone. Yeah, I'm gonna write this down, okay? And it's just gonna go in my notes for you, okay? I'm not diagnosing you today. I don't think that's necessary right now, unless that's something you want, but I just wanted in my personal... It's not my personal notes, but it is the part of the record that is just for us. Okay. So, can you tell me what you notice about this candle? Yeah, kind of green on the inside. Right here. Yeah. So, what I'm getting at here is, if you can, as much as possible and as hard as it is, if you can get yourself out of your head and out of these thoughts and back into the world, into the present moment, that's going to be a really powerful tool for anxiety resilience. Anxiety will come, and we can't stop that from happening. It's not in our control, but we can practice being present. I find it really helps. When I'm in the thick of an anxiety attack, something more akin to panic, one thing I lean on often is I'll go to my fridge, grab an ice cube, and just hold it. And there's something uncomfortable about that a little bit, but it does bring me back to my world, my family, my friends, my body. Yeah. So, what I'm getting at here is maybe it's not an ice cube for you, but maybe it's light a candle and watch it burn. And just practice being curious about this. That's hard. That's really not easy. And I know that you might have heard this before. I know. I hope if you have heard this before, it's more of a reminder. I know it's not as easy as it sounds, so I understand. Okay. Can I listen to your heart one more time? I just want to see how we're doing. Yeah. Thank you. Things are starting to sound better. Yeah, can you tell? Yeah, it sounds like you have some pretty good awareness of these symptoms. Yeah. So, I have some samples you can take home. You don't need to stop at the pharmacy. Yeah, we get tons of samples. You're welcome to have them. This is your inhaler, your rescue inhaler. And there's a little counter on the top, okay? So, send that home with you. And I'm also sending you with some melatonin as a sleep aid. Again, this is take it before bed. It may or may not help, but we have the samples and it's worth trying, okay? Yeah. And if you're sleeping fine, then you don't need to take it if you don't want to, okay? Okay. Your heart's really strong, and you're doing great. And I hope I don't have to see you again, but I also hope that I do get to see you again. Yeah. Well, don't be a stranger if you're ever in this department. For whatever reason. I'm pretty busy, but I'd always love to see how you're doing. So, lastly, I will write that referral to the respiratory specialist. Yes. And would you like a referral for mental health? Do you have a therapist? Would you like to try it? I have a therapist and it's very worthwhile to me. And I think it's important, but don't want to put it on you. Okay, I'll write the referral. And that can take some time to find a good match. So what I'll say is, don't give up. Don't give up if the first therapist you visit isn't for you. Okay. I think you're gonna be okay. I really do. I know it doesn't feel like it sometimes, but you are. You're doing good. Your heart is strong. Alright, keep getting exercise and take care of yourself, okay? Alright. I'll see you. Bye now.